Let's start with what the most people outside the industry think about first, USPH inspections. Captain Thomas, I know you have decades of experience with this. Would you say these inspections are the gold standard?
Well, you know, Dimitru, the U.S. Public Health Service Vessel Sanitation Program has been very successful over the past 40 years for several reasons. Number one, it's a cooperative program with the cruise industry. The VSP Operations Manual, covering 8 key public health areas of concern on cruise ships, was developed cooperatively with input from Cruise Line International Association, that's CLIA, the cruise lines, and the shipyards that build the cruise ships. These are some of the highest standards based on model codes and best practices in the world. And number two, the periodic unannounced inspections performed by the VSP are actually paid for by the cruise lines. It's a fee-for-service inspection program, and the cruise ship being inspected is presented with an invoice at the end of the inspection. Number three, the inspection reports themselves are actually published on the VSP website so that the public can read them. Additionally, there is a score given in which points are deducted based on the associated risk with each violation of the operations manual observed and documented in the inspection report. There are 4 and 5 point violations that are considered high risk, followed by the 3, 2, and 1 point lower risk violations. Also, officers conducting the inspection have the discretion of giving an asterisk, and no points are deducted when there are extenuating circumstances that warrant it. And 86 is the lowest passing score. 85 or below requires a reinspection. And lastly, number 4, something I really like, the cruise line must submit a corrective action statement as to how they will address and correct each violation, including any asterisk items. If that asterisk observation shows up again on the next inspection, more than likely points will be debited. But, you know, I have to say, despite the success of the VSP, the increased compliance with the operations manual requirements, and the corresponding improved scores over the years, the true success of a quality public health program that is preventing illness and injury and responding to outbreaks and emergencies, it really comes down to the day-to-day operations on board, both officers and crew embracing the standards of public health, the cruise lines, the VSP, and the traveling public have come to expect. That's the gold standard.